FreshPod is created for industry professionals and is intended for educational purposes only. This content is not designed for patients or consumers.
I looked over the last 12 months, my rebooking rate is 88%.
Oh my gosh.
And my retention rate's 90%. Last time I looked, I think rebooking rate was 85%. I said to the girls, okay, we need to make sure that we are rebooking each and every one of our patients. And, obviously you're going to get the ones that don't have their schedule or, I'll let you know. And I think that's where we've got that little gap.
Yeah.
But I always say book it in. We can change it if needs be. Once you know your schedule, we can always move it. That way you've got that flexibility. They've got that appointment, they'll get that reminder.
Yeah.
If they need to change it, they can.
Welcome to FreshPod, your dose of genuine conversations, insights from industry leaders, and real business strategies for healthcare professionals and clinic owners. I'm Loz McGlynn.
And I'm Dr. John Delaney. I'm a medical doctor and I'm co-founder at Fresh Clinics. Our mission? We help healthcare practitioners deliver exceptional patient care while building thriving, sustainable businesses.
Today's episode is all about what happens after the treatment. How do you turn a first-time client into a regular long-term patient?
According to the 2025 State of Medical Aesthetics report, more than 60% of clinics say their patients don't return because they either stop treatments altogether or they go elsewhere for better pricing or a wider range. So, what could be missing?
We're so excited to have Jaci Isaacs with us, founder of Art of Aesthetics. She's built her brand on connection, trust, and a genuine but also strategic approach to patient follow-up. Let's get into it.
Hi, Jaci. Welcome. Thank you for coming in to have a conversation with us today. We've known you in the industry for years and years, and your clinic is known for being such a high-performing clinic that has a great deal of patient retention. Why do you think patient retention is sometimes overlooked by clinics when you look around at some of your peers in the industry?
I think people are worried about appearing salesy and pushy when in fact it's not about the sale, it's about the relationship that you're building with your patient. I think it's overlooked and people worry about, their pricing or that, they're not going to come back if they don't give them what they want. So I think it's more about building that relationship from the start. That nurse-patient relationship is super important, or doctor-patient relationship, and building a treatment plan. And I think having a treatment plan in place, it sets that framework for your patient to know that you genuinely care about their treatment and reaching their goals.
So the conversation at the start or early on at least is about a treatment plan, establish your shared goal together, and then the rebooking is a part of that plan, not an additional grab for another appointment or something like that.
100%. So you set that framework in place from the get-go. All my patients are treatment planned from that initial consultation. And I think that consultation, it's, drummed into people, but it's overlooked. That consultation is
because if you try to bolt on that at the end, it can feel a bit awkward if it's not set up in right. So front loading that expectation, then it just becomes an ordinary part of the experience and the relationship. And you're right, it creates that feeling of service and value. That you are invested in their journey, their story, the creation of that goal that they're trying to achieve.
Yeah.
I think too, it's in the patient's best interest that they do come back.
Yes.
It's like sometimes people can feel like it's an obligation. And so sometimes even when you have people that are you can come back, but only if you want. That can set the tone of, perhaps that healthcare practitioner doesn't think it's a necessary reason. It's not necessary for me to come back, so I potentially won't.
We'd actually spoken on a previous episode of this podcast about the difference between price and value.
Yes.
And you were mentioning before that sometimes people over-index on price and don't take that moment to build value, convey service, be the expert in the room.
Yes.
Can you tell me a little bit more about that and how you set that up?
Yeah, I think it's honestly not about the pricing. I think it's about bringing value to your patients, and the right patients, they won't even question your pricing. So I think that is a mistake that a lot of injectors make, in not just injectors, cosmetic nurses, because it can be skin, it can be, the injectables, but it's a common mistake that they're so focused on being everything to everyone and trying to wow them in that first setting, trying to win them over to come back. It's not about that. It's about building that plan and genuinely investing in that patient's outcomes and setting that framework from the start, and advising them the process and how to achieve
And you
that.
talk about, Jaci, the right patient. That's the right patient for you in your clinic.
Yes.
And you've worked out what the sweet spot is for you. That won't be the same as someone else, right? But if you want to create value, you can't be all things to all people.
You can't be everything to everyone. And I think it's important to know that not every patient is for you.
How long did it take you to work out your patient, the profile that works best for you?
Very quickly, actually, because in the area that I'm in Parramatta, there's lots of chain clinics around, per se. And, you do get a lot of people coming in and questioning your pricing. And I'm like, it is what it is. If you are coming to me for me, I don't even enter into it really. I just say, that's fine. If you want it cheaper, you can go there.
Yeah.
That's fine.
Yeah, that's that confidence, isn't it?
Yeah.
Backing yourself.
Back yourself.
And there is a bit of a challenge for healthcare professionals, in that sales isn't what we're drawn to or coached in or trained in.
Yeah.
My training was in emergency medicine, and I've reflected on that. That's one of the best sales training programs anyone could go through, because you're constantly selling patients. I'd have to call up a registrar and try to convince them to admit a patient, and that was a sales job. And we all do that, and nurses do that all the time. You've got to convince the doctor that your patient is in pain and needs analgesia, or you've got to convince the NUM that a certain patient needs an additional element of care. So it's not that we're not trained in the art of persuasion, not trained in the art of putting a case forward, but suddenly we get into our own businesses and there's a feeling of awkwardness around sales and being salesy. How do you navigate that? How do you maintain your integrity with your patients while still putting the case forward for what they need and what your business needs?
I just explain to my patients, and I say this at the bottom, is a little excerpt in the bottom of every single treatment plan. You can do as little or as much or nothing. It is completely in your hands, but this is what I suggest based off our assessment to achieve the results that you are after. And I think if you put the emphasis on the plan of care for that patient, be authentic. Our clinic has 4 core values: authenticity, advocacy, care, and excellence. So if you stay true to your core values in your business, I think it just flows.
I love that, Jaci. And I think a thing I would strongly advocate for any clinic owner listening or injector listening is work out what your values compass are. What are those 4 things that you want to hold true to? Because you can start to then make decisions based around that. And I love yours. That's awesome.
Another thing that people talk about is, a patient seeing you for the very first time, a patient that might be seeing you through word of mouth, or a patient that you've seen for a really long time. Is your approach with each of those patients a little bit different, especially for those patients that are seeing you for the very first time?
It's exactly the same.
Okay, cool.
So whether I have seen that patient for the last 8 years from where I used to work previously, and they've come to see me in my clinic situation, or whether I've met them yesterday or they're booked through word of mouth, they will still have a full facial consultation and assessment. They still get an individual treatment plan. And like I said, whether or not they want to stick to it is in their hands. But I just, set up that framework from the start with every single patient.
Yeah, That's amazing, because it's like that's a part of your brand and your experience. So if you're delivering that, one, you're going to be really good at it because you're doing it day in, day out with every single patient. You know your flow. And so then that makes the whole experience for you and that patient really cohesive and really natural. But then also if that patient, a new patient comes and sees you, has that experience, and they refer to a friend or a family member, they are also going to have that experience.
And whether they see myself or one of my other nurses, they will receive the exact same treatment.
Yeah, consistency breeds confidence.
Yes.
And it's also a marker of quality.
100%.
You know what you're doing and you don't miss anything. I endorse that as well. And then how does that consistency work in the post-treatment environment? So when the patient leaves, without giving away your special competitive secrets.
Quite open, actually. I don't mind.
How does, well, I love that too, because I think there's business for everyone, and the better we all do, the better everyone does. So, you know, with the Fresh Clinic software, there's aftercare documentation that goes out to every patient that satisfies the APRA requirements, but also is a very reasonable and practical thing to do.
Yes.
But from a service element, from your business continuity side, how do you manage follow-up and staying in touch with that patient and keeping them engaged even when they're not in the chair?
So our system will automatically send out, I obviously advise them they will receive an email from Fresh Clinics stating exactly what they've received today, how many units, what areas, and the specific aftercare. I will then advise them that we will touch base with them in the next, 1 to 2 weeks. Our system automatically sends out a thank you for coming. We hope you've had a great time. That type of a text message.
Yeah.
We also have a follow-up system in place as well. So every patient that's seen, we book a 2-week follow-up regardless of whether they need it or not. We advise them they can cancel that if they are happy. But that allows us to, adjust their treatment plan if needs be. And also, it just brings them back in.
So they opt out rather than opting in?
Yes.
Yeah, you book them in as a default?
Book in as a default, yep. And they can opt out if they're happy with their results.
Yeah,
and I say, even if you're happy with results and you want to see the before and afters, by all means, pop back in.
Yeah.
And obviously that follow-up is part of their treatment plan anyway. Patients that we see for skin, we will follow up a month later, to give them that, between 4 to 6 weeks, if we've popped them on skincare to allow their skin to adjust. And, we just have this protocol and policy in place for follow-ups to ensure that the patients are being consistent with their treatment plans.
Yeah, great.
How did you decide what that process looked like? Is that something that evolved over time and experience? And also, did you, in like things that you mentioned about introducing automated email and SMS notification, how did you choose?
Yeah, so I think trial and error. I think I've always done a 2-week follow-up with all my patients regardless, because, obviously 2 weeks is when patients generally will see their results or need a tweaking as such. But over time, especially with the skin patients, that was learned. You need longer to see changes in the skin. So our patients that are purely doing skin treatments, we see 4 to 6 weeks post-treatment. Yeah, I think it's just you do what works in with that patient. Obviously, each patient is going to be different as well.
Yeah.
So you got to be able to bend and weave and adjust as a business as well. But you might see one patient more than you see another, and that's okay. Yeah.
Fresh Clinics is your trusted partner in modern healthcare and aesthetic practice. From business coaching and compliance support to tools that streamline patient care, we're here to help you build your clinic your way. Join hundreds of nurse-led clinics already growing with Fresh. Visit Fresh Clinics to learn more.
Do you actively seek feedback from your patients? And if so, how do you get that?
Yeah, so look, we value feedback immensely. So again, we automate. So, they can leave feedback if they choose to. There's a link that they can click. Some people do, some people don't. But that value is essential to the growth of your business. So even just verbal feedback as well is super important. And that has changed how I've done, skin treatments, which were secondary to what I was trained. I've learned to be slower, learn to be, just from word of mouth. Oh, that was lovely, but I feel rushed. Something so simple, you adjust it and then, it just flows.
Yeah. And if you get that feedback point, it's probably the case that other people have felt that way and just not said anything.
Yeah. So I think feedback's crucial to the growth of yourself as a practitioner and the business itself as well.
Yeah. And with those automated functions that you've described, you can start collecting that without having to be again salesy about it, right? That can all be automated and built in. What software system are you using for that?
Currently using Timely.
Yeah. Okay.
So, but there's quite a few good ones.
There's a number of them around. Yeah.
Talking about like reviews and people coming back for like a tweak, I have this story that I tell so many people, and it's actually my mum. So it's mum if you're listening to this, but my mum had never had any aesthetic treatment before. It took her a long time to get the courage to actually go in and have a treatment. She had a tox treatment, and there was no trigger for to come back, to rebook, to go in for, where we review it the 2 weeks. And she actually had a spock, and we called it a party brow. But because she'd never had the treatment before and there was no like aftercare sort of put in place, except if you have any questions, just reach out. Like, it was quite intimidating for her to go into the clinic in the first place. And so for her to then have the confidence to call up and say that there was, something she was unsure about, it felt like a lot to her. Whereas had she had a little bit more of consistent touch points or a text message or it's really normal if you need to come back and see me at 2 weeks, I think her experience would have been completely different. Whereas she then decided, it's just not for me. Like, I didn't like the result. And that sticks with me because I'm like, had she had someone that maybe took a little bit more time with her, held her hand, understood and empathized that it was her first treatment, I think she would have been a regular tox patient or sought other treatment with that healthcare practitioner.
I always say to the patients just before they leave, don't walk around unhappy.
Yeah.
That's what I'm here for. So all my patients get a business card with my business mobile number on there. Call me, text me.
Yeah.
And this is my point of difference. So I tell them that you've got me.
Yeah.
Or you've got, whether they're seeing my other nurse, you've got so-and-so.
Yeah.
So it's that being personable, being human.
Yeah.
And I think if you've got that human element and you're authentic, then that just naturally, encourages people to feel comfortable to reach out.
Yeah.
And you want your patients to feel comfortable to reach out.
Do you find, Jaci, that people are connecting with you on text message or call, or they want to come in person? Like, what's the mode that you're in at the moment?
All three.
Yeah.
So you get a bit of both, but some people don't like to make phone calls, they text.
Yeah.
We are now moving it forward to, the clinic phone. So, there's an automated message that pops up now, especially in line with the regulations to contact the clinic. Basically, my long-term patients that I've treated, 8, 9, 10 years ago, I still see them. So, they're the texters. But, and I always say, if I don't answer the call, which I can't, a lot of time when I'm in clinic back to back, I cannot answer the phone. I say, if I don't answer, just text me and I'll call you back as soon as I can.
How do you manage, people talk about this all the time, but Instagram is obviously such a great point of marketing and like educating patients, but then people slide into the DMs and they might have a random question, like get bombarded with messages. How do you manage that? Because there's obviously so many channels of communication. So what does that look like?
For years, and this is where I made a mistake from the start, obviously before the regulations changed, answering. And it got to the point where, it was very overwhelming. So then we automated the automatic message. So if anyone DMs us, an automated message comes on with the direct link to either book or call the clinic directly.
Perfect.
So that's, obviously it pops up automatically and that way I don't have to monitor it anymore.
Yeah.
And if they're genuinely interested, they'll call.
Yeah, perfect. Because it's really easy to get into the habit of like, oh, I just want to like give good a patient experience. So I'll just write back to this person. Yeah.
Yeah, but in line with the regulations, you can't give out medical advice via social media messages. So yeah, that fixed that.
And are you integrating any new technology for this sort of service? Like I know of the AI messaging services. There's automated text message chains that can do chatbots and things like that. Is that something that you're looking? I mean, you're a clinic that's sort of bigger than many, bigger than the average, I guess. Although you still maintain that boutique service. Yeah, it's still growing. What's that look like for you as you look at new technology and the way you serve customers?
So look, there's some really good programs coming out.
Yeah.
Have been looking into, some of the new technologies.
Yeah.
At the moment, I always say if it's not broke, don't try and fix it.
Yeah.
So we're just, still using what we have in place. I think systems and processes are super important, and that forms the backbone of your business.
Totally.
Changing would be logistical nightmare,
It's a big deal
at the moment. But yeah, when I'm in the headspace to do it, I think, I'm really excited.
Talking before about in earlier podcasts about business metrics and some people find it hard to find the bandwidth to just make the time. And I think similarly with your systems and your processes,
it's just there.
Just finding the time to get those things right, because sometimes it's easy to plow on with an inefficient system or a piece of technology that's not quite working.
Yes.
To then find that time to actually, okay, we've got to think about this from first principles. How do we make it work?
Yeah.
Do you find time to do that? Do you tool up on your processes, or do you have someone help you with that? How do you go to that next level?
Okay, so disclaimer, I'm a nurse, so business isn't my, forte. So my husband is all over it.
Yes.
So, he does it in his spare time. God love him. But but all the data's there. You've just got to be able to pull it and see it. And, I'm learning and, I'm starting to see it more. So we're talking about rebookings. I pulled up my rebooking rate.
Yeah.
I was like, oh, wow. I was actually shocked, but he knows it. He's like, yeah, didn't you know that? I was like, oh, I had to look.
Do you know with your rebooking rate, is there anything that is more successful at driving rebookings that you've noticed just from looking at your data?
Well, I looked over the last 12 months, my rebooking rate is 88%.
Oh my gosh.
And my retention rate's 90%.
Wow.
So, and that I pulled that figure this morning, but I was actually shocked. And I was like, wow. Last time I looked, I think rebooking rate was 85%. I said to the girls, okay, we need to make sure that we are, rebooking each and every one of our patients. And, obviously you're going to get the ones that don't have their schedule or, I'll let you know. And I think that's where we've got that little gap.
Yeah.
But I always say book it in. We can change it if needs be.
Yeah.
Once you know your schedule, we can always move it. That way you've got that flexibility and you haven't, you've rebooked them.
Yeah.
They've got that appointment, they'll get that reminder.
Yeah.
But it's, if they need to change it, they can.
Yeah, yeah. And people can change their own online. They don't have to call you.
I think they can change it once online. Otherwise, they just call or text. Yeah.
It's such a good point because life's busy, right? So people forget how quickly time disappears. I mean, we look to if my hairdresser didn't rebook me in every 6 months or however long I go, I would completely forget and 12 months would slip away. So you're actually doing them a service by just going, let's book in. If you need a change, you'll get a reminder and we can just move it. That's fine. And I think little things like that do really make a difference. Is there anything, Jaci, that you have implemented that you notice made a fundamental difference in your business, whether it be a workflow or a system or just the way you were having conversations and you were like, wow, that actually really changed patient behavior?
About 2 years ago, we implemented just an automated text at 12 weeks. Hey, friendly reminder, your next treatment is coming up, feel free to book in, click here. And that made a massive
So simple.
So simple. Yeah. Should have thought of it earlier.
Yeah. There was something you were mentioning around your patient retention and rebooking rate. I don't know why you're shocked that it's so high, but there are so many so many ways you can look at that, whether that be through Timely. We also have a custom insights dashboard on the Fresh platform where you can look at things like your retention, patient demographics. You can sort of see like your dosing from a tox perspective and those bits and pieces. It's also a really good way as a team to sit down and go, hey, like look at how we're performing. Like look at how great our patient retention is. Like you guys are doing a great job. Or we've noticed that this patient demographic isn't as high as that potential patient demographic. So all of like to look at your numbers is actually, it can be quite empowering and really reflective as well, which is awesome.
So Jaci, I mean that the retention rebooking rates you've got would stand out in any industry, I think, and in an industry such as ours, which is competitive and based on trust. You've done a tremendous job in building that trust with your patient base.
I try.
Yeah. What if I was a new person entering the industry and I'd come to you for advice? Is there any, what are the sort of highlights that you would give to help me to generate the sort of trust and relationships that you've been able to do?
Just be genuine, be yourself. People value honesty, provide value and service, not just the treatment. So I think if you are genuine and authentic, people see it. And I think if you are not, they can see it as well. So I think just be true to yourself, have your patient's best interests at heart, and treat every single patient as if they were a family member and they become your family,
Yeah.
And, obviously within boundaries. But, it's just about being you.
I think that
being genuine.
That's such a valid and really timely reminder to everyone that it's actually the whole package of value that you provide that is the differentiator for your business. People can get injectables anywhere. Yep. Why do they come to you? They come to you for the service you provide, the value you provide, and your intelligence and your experience and all those sorts of things. So that's such great advice.
The last question I want to ask, which is a rogue question, but Jaci, you are we love chatting to Fresh members and just hearing, the successes of the business the businesses that you build and the patients that you see, the retention rates that you have. Working as a business owner and in this industry for such a long time, what's something that you're really proud of?
I'm proud that my patients know I care, and I do. So, I'm proud of where I am because, I've built it from scratch. So, each patient is a reflection of, me and, just the care that we provide for them. So, yeah, I think any patient that comes to Art of Aesthetics just, they know we give them that care factor. Yeah. And I think that's what it's about.
I think, Jaci, it's a good point that you did build it from scratch. It's easier to come into this industry and you look at some of the stalwart, bigger clinics, independent clinics, and you think they were born like that. They started as a big clinic, but they didn't. They started, I can remember very early days with you, Jaci, and small clinic, a little day a week. I think, did you start early on? You were
had a 4-month-old baby.
Yeah,
started 1-2 days a week.
Yeah,
one patient at a time.
That juggle is real, and just congratulations to you for staying true to yourself and building a business that reflects what a genuine, lovely person you are.
Yeah, and Jaci, thanks so much for coming in and having this conversation, sharing your experience and your knowledge. My biggest takeaway is that consistency is key and be really genuine, which we love. We love the authenticity. JD?
Yeah, I think my takeaway is start the treatment plan with your patients early, because then having the patients come back is not it's not a function of a sales bolt-on. It is actually part of your care. Yeah. It's part of your care plan. So have the confidence to talk to your patients about what are they really trying to achieve here, and that it's going to take some time. It's not a one and done. Yeah. I like that approach.
Yeah, absolutely. And there's so many tools and resources out there that are available. Lean into your fresh community, lean into the resources that we have available as well. We're here to support. And yeah, thanks so much, Jaci. This has been awesome.
Thanks, guys.
Thanks, everyone.